Welcome to Essential in Public Health module. This lecture is to introduce to you what is meant by public health. It is hoped that by the end of this session that you will understand what are the health determinants in relation to public health core functions, essential services, as well as the approaches used to deliver the services and the challenges faced. Health determinants can be better understood if we understand the concept of public health and study public health from the ecological perspective. There are 4 determinants of health. Human biology, that is presented by the characteristics of an individual, age, gender, ethnic, environment, geography, climate, modernization, as well as economy, behavior or lifestyles, and the healthcare organization or system. With regards to human biology, every human being is made of genes. In addition, there are factors which are genetically transmitted from parents to offspring. As a result, there is a chance of transferring defective trait. The modern medicine does not have a significant role in these cases. However, several methods have been identified and proved to be useful, such as genetic counseling, which is given to married couples with inherited genetic disease, or aged parents could be made aware of the risk of genetic defects in order to overcome some risks that could arise. Genetic engineering may have a role in cases like breast cancer. On the other hand, environment is all that is external to the individual human host. Those are factors outside the human body. Environmental factors that could influence health include life support such as food, water, air, and etc., physical factors, climate, rain, biological factors, microorganisms, toxins, biological waste, psychological, social, and economic like crowding, income level, access to healthcare, chemical factors, industrial waste. The environment is crucial for human well-being, but this is what happens when the environment is not protected or preserved. Most damages to environment are due to human actions. Bad environment leads to ill health. Lifestyle or behavior of an individual is an action that has a specific frequency, duration, and purpose, whether conscious or unconscious. It is associated with practice, and it is what we do and how we act. Recently, lifestyle by itself received an increased amount of attention as a major determinant of health. Lifestyles of individuals affects their health directly or indirectly. For example, cigarette smoking, unsafe sexual practice, eating contaminated food, lack of physical activity. Bad lifestyle or bad behavior leads to sickness, disabilities, and last but not least is the healthcare organization in terms of the health system and its resources such as human power, equipment, technology, political commitment or allocation of money, and so on, determine the health of people. It is concerned with availability of health service. In other words, people living in areas where there is no access to health service are affected by health problems and have lower health status than those with accessible health services. Scarcity of health services leads to inefficient health service and resulting in poor quality of health status of people. It is important to ensure acceptability of the service by the community, accessibility in terms of physical distance and finance, quality of care that mainly focuses on the comprehensiveness, continuity, and integration of the healthcare. Ecological perspectives are about the physical, behavior, and socio-cultural determinants and the community at large. Physical determinants. The physical factors affecting the health of a community include the geography, such as highland versus lowland, the environment, such as man-made or natural catastrophe, and the industrial development, such as pollution, occupational hazards. Socio-cultural determinants. The socio-cultural factors affecting the health of a community include the belief, traditions, and social customs in the community. It also involves the economy, politics, and religion in the community. The ecological perspective also mentioned on behavior. Therefore, behavioral determinants affecting health include individual behavior and lifestyle affecting the health of an individual and the community, such as smoking, alcoholism, and promiscuity. In addition, it includes community organization. Community organization include the community size, arrangement, and distribution of resources, relations to productions. To summarize, both the health determinants concept and ecological perspective can be seen in the multi-layered sphere as illustrated by Dahlui and Whitehead. The individual characteristics of the traits that determine some genetically inherited disorder and the physical appearance of an individual, such as gender, skin color, hair, height and size, the behavior such as inherent and from experiences, as well as social reactions, living and working conditions, broad social, economic, cultural, policies at the global, national, state, and local levels all have effects on the individual. Refer to the diagram. Health is determined by many factors: biology and genetic endowment, personal health practices, coping skills, health services, income, social status, social support, employment and working conditions, physical environment, education, healthy child development, as well as others. You can obtain and maintain health, although not everyone is fortunate to be born healthy. Health results from a combination of factors which need to be prevented or to work for. We have to practice healthy lifestyles if we are to maintain healthy, such as not to overeating, because it can lead to overweight or obese and get associated diseases like hypertension, diabetes, and heart disease. Take on risky behaviors such as smoking, drinking alcohol, abuse narcotics, or engage in free sex, drive fast, and not wearing seat belts or helmets when riding motorcycle. Exposed to infectious diseases, eating contaminated foods, traveling to outbreak areas not immunized. Some diseases like cancer can be prevented if we go for screening. Breast and cervical cancer for women, for example, liver and colon cancer. Stop polluting the environment because the environmental hazards will affect you and your family. Always avoid injury, focusing on social determinants of health, education, income, family, country situations are very important. Education is important because not only it is a vehicle to better employment and thus higher income, but enables the people to be aware of their health status and health needs. The availability of income at individual and community level is necessary to obtain and maintain health, as well as to prevent diseases. Income at the community level is on the making of the availability of health facilities or health services, while income at individual level is on getting access to treatment of diseases, and in the form of obtaining nutritious food as well as stay in healthy environment. Some of those are so poor until they have to live or stay near the dumping grounds. No one can live healthy if alone. People need another people, either family, friends, or society at large. War and conflicts bring suffer, injury and illnesses to the people, and like disasters like floods, earthquake, tsunami can displace people, causing loss of life, injury and illnesses. People without or with low income live in poverty, and poverty makes people homeless or live in poor housing surroundings conditions. With unsafe water supply, no food or not enough in quantity, and most of the time taking non-nutritious food, people living in poverty also lacks access to healthcare services, and their sickness leads them to deeper poverty. Jack Smith explained the roots of health inequity using the factors identified as the social determinants of health. The economics and social conditions have significant influence on the health of individuals, communities, and jurisdictions as a whole. They include but are not limited to safe, affordable house, quality education, job security, social connection and safety, living wage, access to transportation, and availability of food. A study has showed that the social determinants of health, such as education, employment, income, family and social support, community, safety and environment contribute 40% to a person's health and well-being, according to the Population Health Institute.